Do you have any experience in converting an artificial disc to a fusion or a fusion to an artificial disc, maybe a one that didn't heal, pseudarthrosis?
I've had two patients in my recent, one was about 2 years ago and one was about a year ago, who've had prior fusion performed and they did not heal. And I felt it was almost nature fighting what was done unjustly by fusing a segment that wanted to move. And in those patients, I had a conversation with them and took them back to the operating room. And really the strategy was we will go in there, we will take out what has not fused. And if the environment within that disc was still amenable, and without going into technical details of what that means, but if the environment was still amenable for an artificial disc, that I would convert them to artificial disc, and I was able to successfully convert them to artificial disc. And those patients went on to heal and have done incredibly well, have sent me many cards, many patients of friends and family members and other colleagues. So yes, that can be done. On the flip side, if you have occasionally a patient who has received an artificial disc and for whatever reason, either it was done improperly or the sizing was not correct and they've had a failure, then those patients may need additional surgery at that level. Some of those I have converted them to another artificial disc and achieved more proper positioning, more proper sizing, and have done well as well. And I've had two patients who've had artificial discs that then once they were taken out, the amount of damage that had occurred to the underlying bone was such that it could not support an artificial disc. Those patients were then converted to fusion.
I've been reversing fusions, failed fusions, and in some people that, like we were talking about, who have 3 and 4 levels already fused and they're so restricted. And I had one woman that the first one came to see me. She had a 3-level fusion and her C6-7 was normal, but it had failed because of the stress load on it. And she wanted an artificial disc at cervical 6-7 and asked me, hey, is it possible to change one of my fusions to an artificial disc? And when I did the CAT scan, which is critical to assess the facet joints to make sure they still look open and healthy, well, they were at the one above at C5-6. So I was able to cut out that fusion, which was solid, and place an artificial disc there as well as at C6-7. So then she went from a 3-level fusion down to a 2, and actually she can play golf again because she can get her head down. So she's very happy, and that was 8 years ago. So you can convert selected patients, but yeah, but like Armen has done, and I know Rick has done, if you have a pseudarthrosis or a failed fusion, most of those convert quite well to artificial discs. I have a very large series, and they do, like Armen said, they just very happy patients, and they keep their mobility, they regain some mobility, they have their pain scores are superb, they're very grateful patients.